very nice.
Okay, so I first connected with Louise after having listened to her on a live recording on LinkedIn, and was fascinated by the work that you're doing on breathing and perimenopause, and how it affects us, and particularly things like this aha moment for me when you're sort of talking about the carbon dioxide levels as well. And I thought, yeah, that is a definite issue for me. I can't hold my breath for very long at all, and I used to be able to hold it for ages. So that was why I kind of connected with you, because I thought this is fascinating and I'd love to get you to talk to the ladies in my group. So welcome. It's really nice to see you here, and over to you. Do you want to share a screen at all?
I may do as we go along, and thank you everyone for having me here. I'm Louise Oliver. I have two hats. I have a GP hat and a hat where I'm a breathing practitioner and a therapeutic life coach. So I basically use my life coaching skills to try and persuade people to breathe better, basically. So I've been GP a long time, looking after women, over 20 years, looking and seeing them at various points in their reproductive life. And I've always sort of thought there's a bit of a missing piece. And I had an aha moment when essentially I started snoring in my perimenopause. And I had 4 symptoms and went on HRT. 3 of them stopped, and then 1 of them, snoring, didn't stop, and I continued to snore. My sleep deteriorated, obviously.
Oh, we just lost you.
It was unpleasant for my husband. We often, did you lose me? And we often don't talk about the sleeping partner. So I was being very noisy, which obviously then makes me grumpy. It makes the sleeping partner grumpy. Often end up in separate rooms. And then for whatever reason, I won't bore you with the details. I'd already beginning to sort of explore a bit about breathing, and I recognised I wasn't breathing efficiently, despite running 3 times a week and despite not feeling breathless. And then I corrected how I breathed, and then I basically sleep quietly, sleep much better than I've ever done, and I'm back in the bed, not getting moaned at by my husband, and which is obviously a positive thing. And also I can run with greater ease, I get less breathless, and I feel calmer. And essentially I couldn't believe that other people don't know about this, or not so many people know about it. And that's when I started to do work with individuals myself and with groups. So I don't know where you want me to go from there, but essentially we've got, I think, how we breathe is really, really important, particularly as we transition through to perimenopause and menopause. But I don't know where you want me to go. I could talk forever.
Yeah, well, I'm happy for you to talk for at least half an hour. But I mean, one of the things that was massively fascinating for me was when you said you ran a 10K in home first, which is really not flat, with your mouth taped. Yeah. Which is just incredible. So I ran for the first time in 2 years yesterday, and the whole way around on this 5K I was going, right, see if I can breathe with my mouth closed, see if I can breathe with my mouth closed. I had that really in my head. But do you know what, just making a conscious decision, and I've been doing that in my fitness classes as well, making a conscious decision to notice, am I breathing with my mouth open or my mouth closed? Can I breathe with my mouth closed? Has been quite interesting. And I mean, my husband would like me to stop snoring. I do need to do that. I don't have sleep apnea because I don't stop breathing.
Yeah.
But I have noisy breathing, if that makes sense. Yeah. And I know that I've got the sort of the carbon dioxide issue, because I used to be able to hold my breath forever. And now I kind of try and hold my breath and go, oh, no. And I know I don't need any more oxygen. So it's got to be the carbon dioxide thing. So I'm really fascinated about this thing and sleeping and perimenopause, and why. So can we start with why this might start to appear?
Well, I think if we just think about breathing, and then I'll just go on to that. So really briefly, and I've been a doctor a long time before I realised this. So just because breathing is generally automatic, it doesn't mean it's automatically efficient. And that's the first thing just to recognise. So there's a spectrum of breathing efficiency. We can breathe efficiently, we can breathe really inefficiently, or anywhere in between. And I was probably midway. Essentially the mouth has no role in breathing apart from making it inefficient. And when we think about it, how we breathe when we're asleep is our unconscious breathing pattern. So that gives you feedback on what your unconscious breathing pattern is. So if you're breathing with your mouth while you're asleep, but mouth open whilst asleep, it's noisy, there's heavy snoring, there's gaps in breathing. That's your body giving you a little bit of feedback that it's not quite as efficient as it was. And I remember having a very negative reaction. So if anybody's hear me saying that and they feel a bit sort of like, I get that. I was like that. I had the American definition of sleep disorder breathing in front of me, and I was like, no, I don't have sleep disorder breathing. And then I read it again, and I was heavily snoring. So I thought, right, get a grip, Louise. Yeah, you've got sleep disorder breathing. So I'd done some mindfulness. So I didn't engage with why I was here. Forget that. I am here. I'm snoring. What am I going to do about it? And we can correct how we breathe. If you think how a baby breathes in and out of the nose, and you see the ribs and the belly sort of expand on the inhale and then drop down on the exhale. And that is how we've been designed to breathe. It's just living in modern day society and perimenopause and menopause, I'm coming to that. We have this tendency to slip towards more breathing inefficiently. And in my personal opinion, I can't back this up with a paper, I think wearing masks over COVID. You put a mask on someone, unless you know the importance of nasal breathing. And I know this because when I put a mask on at work, automatically I go to mouth breathe. But because it feels weird, I then go, no, come on, Louise, nasal breathe. And I think it's converted a lot of us who were nasal breathers possibly to get a more mouth breathing habit. So I think that's part of the issue. Now, what happens, the research has shown for a number of years that there's a steep rise in what we call sleep disordered breathing. Now, what I mean by that is it's a spectrum again. So you've got the gaps in breathing, so the obstructive sleep apnea at the more severe end, in the middle, heavy snoring, and then there's a condition where you've got increased resistance to the air coming in and out. So there's a spectrum of breathing efficiency. I personally think breathing with your mouth open while you sleep should be on that, but at the milder end. But that's my personal opinion. So the evidence is clear. There's a steep rise in sleep disorder breathing as women transition from perimenopause to menopause. And even when the scientists correct that for weight, because clearly if we put on weight, the first place we put on weight is our tongue and the back of the throat. So
that was something that was an eye-opener for me. I didn't realize that at all. That's incredible, isn't it? Yeah.
The tongue gets
the idea of the tongue gaining weight.
But the back of the tongue forms part of the airway where you breathe, so obviously it's going to make it more difficult. But even when the scientists corrected for that, it still had this steep rise. Now there is some thoughts as to why. I don't think it's completely clear. There's different reasons why people breathe differently at night, so it sort of depends. But one of the things is progesterone seems to have a protective effect on our airway. So progesterone seems to have this effect where it makes the muscles more toned, if you like, so less likely to vibrate, which is snoring, or collapse, which is obstructive sleep apnea. But the evidence on HRT helping sleep disorder breathing is mixed. And I suspect that's because different types of HRT have been used and there's different spectrums of breathing efficiency in those women. So I think it's probably the more and more I do with breathing, it's very individualized how we all react to it and how different we breathe. So there's something about the progesterone. So that obviously there might be a weight issue. If we put on weight, that will definitely not help. It's something to do with progesterone is protective, and then we lose some of that. The other thing is we talk about we're going to lose muscle mass if we are not doing some sort of resistance training to keep those muscles going. We have got the diaphragm is a skeletal muscle, so it's just like the bicep muscle. If you don't use it, it gets weaker. We've got other muscles in between the ribs and the back of the throat. Obviously, there's all sorts of collagen and muscles and all sorts of connective tissue. And again, if we're not training that, it's not going to remain strong. So you this week have been trying to be doing your exercise with nasal breathing. You are doing inspiratory muscle training with that because you're having to breathe in against a resistance, and that will make your diaphragm and the other muscles stronger. Again, you know, if you have your mouth open, the tongue's in the wrong position, it's floppy, it's not helping those muscles remain strong. And then the other aspect is what you've already touched on, is that there's this tendency in modern society for us to overbreathe. So as soon as we switch to mouth breathing, we're overbreathing, because the mouth is bigger than the two nostrils. And when we overbreathe, it affects our carbon dioxide tolerance, which we can tap into. And I need to spend a couple of weeks reading the research, but from my clinical experience, and I can say this from my clinical experience of working with people, I think as women transition through, I think we get less tolerant to carbon dioxide. But I will put a caveat in, I obviously see a skewed view. People who see me in my breathing role, I've already recognised they've got an issue with breathing. Those that see me at the surgery, they're obviously not feeling well in themselves. So it's going to skew it. So that may not be true, but that's my experience.
When I spoke with Vikram from the UCLH, he was talking about the fact that there's a lot of anecdotal evidence, because there's not been any research on it, that shows that our tolerance of histamine, our tolerance, all of these tolerances, and he agreed that carbon dioxide could equally be one of those, and he thought that was quite valid and quite relevant, were challenges. So, there seems to be this progression, doesn't there, as we go into perimenopause, where things change. We know that the equilibrium has shifted, if you like, the homeostasis has shifted, but there's so much, isn't there, that kind of flips in different directions, and I don't think they understand why. Well, mostly, he says, because they're not able to research it.
And I think carbon dioxide tolerance, I think, is one of the worst things to research, because it's not helpful to do it from a blood test, because it literally can change. You do a breath hold, it changes within like seconds.
Yeah, exactly.
The absolute value of carbon dioxide in the blood is not actually that helpful. It's not helpful to me, to you, a GP in a surgery. It's not going to help. So it's a difficult one, and we don't have a common gold standard agreed method of assessing inefficient breathing. So how can we research this when if I take someone a breathing program, if I had a gold standard assessment method, I could do that before my program, I could do it after, and I could show improvement. There isn't an agreed method. So we've got to go off subjective things, which obviously we don't like for studies generally, do we? But you take someone, I've got a 68-year-old lady who I won't go into her medical history, but she given permission to explain that before the program, she could only, if she did skipping, she had to keep stopping. And then now she's improved her breathing, and now she can skip continuously for 8 minutes. She's 68. She went on a 3-hour walk yesterday, which is the longest walk she'd done. And she screenshotted me her snore lab, and her snoring's gone down each month. So I need to get that on my website. I will do. She's given me permission for that. But so it's you can change how we breathe. We are in charge of that. But it's not because obviously we've all got an unconscious breathing efficiency, and for us to change that, you've obviously got to do some daily work each day with kindness and patience to yourself, that eventually your breathing then becomes more efficient, and then it becomes unconsciously more efficient, and then that's when the sleep pattern improves. So it requires effort, it requires trust in the science, because particularly if your breathing is really inefficient, it's hard. I've been with people where literally, I've had someone sat in front of me, I've asked them to close their mouth for 1 minute, and the fear in their eye, they felt suffocated, they felt they couldn't breathe. But I put an oxygen saturation probe on their finger and said, look, your oxygen is still 98. I can see your fear in your eye. I can see it, but your oxygen level isn't changed. Just bear with it. Let's just check you can breathe for 1 minute through your nose. And that individual did it, but that individual clearly is going to has got so much to gain. Someone like that has just got so much to gain, it's life-changing, but that person will have to be really kind and gentle, and it's going to take months, but they get benefits before then. But it makes it incredibly difficult to study, and this is the thing. But I think this is so relevant to women. It's relevant to everybody, but because our breathing changes as we transition through, and it won't be relevant to everyone. I mean, I think thriving through the perimenopause and the menopause is like a jigsaw puzzle. You know, there's so many bits in there, just so many bits. And I think, you know, we need to step back, and it can be overwhelming. And I think, look, be honest with yourself, which piece have you got the most to gain from this, you know? So for me, or one or two pieces, but probably not more than that, because you get a bit overwhelmed. So for me, it was hormones and my breathing. Those were the two bits. And then obviously I corrected that. And then I feel a bit better now. I've got the energy to work on the other bits. So I'm not saying it's relevant for everyone. I'm saying breathing is a piece on that jigsaw puzzle. First of all, let's raise awareness, and thank you for having me on tonight, let's raise awareness that it is a piece. So how we breathe matters, hormones change breathing, and then ask yourself the next question, assess. How can we assess if you're breathing efficiently or not? And I've given a few pointers for that already, but I have got my thoughts on it. I've done a video on my YouTube channel on Dr. Louise Oliver TLC. And it's, I don't know, it's about 10 minutes of me ranting about different, because there's different ways of...
I subscribe to your YouTube channel. It is quite good, actually. I love watching it. So
I've run out of time to keep uploading stuff. So
and I watch your Instagram videos as well. They're quite good. I usually go, where is she? Can I work out where? Oh, look, running gear again.
I come up with these ideas when I'm running, and then I just stop and film it. So.
Well, why not? Exactly. You know, unfortunately, I usually come up with my ideas when I'm swimming in the sea. Oh. And that's a little hard to video.
Yes, exactly. Exactly. I might have a broken phone.
Yeah, or lost phone. What? Drop it in the sea. One of the other things you were talking about as well, though, on the audio that I listened to, the video with Fiona, was about the position of the tongue when you lie down.
Yeah.
And that I found really interesting, because I was watching that because I was about to do a session in this group about sleep. And so I asked the question, and it was interesting what you said about snoring earlier, because I asked the question, how many of you snore? And I felt a reticence in answering that. And I know when my husband has said to me, you're snoring last night, it's like, don't want to talk about that. Sort of like, I feel that reticence. Go away, you're the one who snores, you know, stop talking about my snoring, you know. But the position of the tongue was a really interesting one, because I kind of started concentrating on that as well, and just thinking, where is my tongue? What is it doing? So maybe you'd like to sort of talk about that a little bit as well.
Definitely. So obviously, if we want to, and that's the other thing, if you're having a problem with sleep, all the sleep hygiene rules and information I completely agree with, but I think there's a question missing at the bottom. How do you breathe whilst asleep? That needs adding on there, and I would love that to go on there at some point. Yes. And if you're breathing brilliantly and quietly and it's in and out of the nose, that's fine. You don't need to bother about that. But
yeah, that's you, isn't it, Tracy? we asked those questions, didn't we? And that's where you were. You got the 10 out of 10. The rest of us didn't. So there's somebody in the group also saying that they're very shallow breather. They're a very shallow breather. So they keep getting told that their blood oxygen is too low. They're getting warnings from their phone, I think.
Right, so what is efficient breathing? So efficient breathing is in and out of the nose, I would say 24/7. It can be amazing how much exercise, not swimming is probably one of the only exercises actually that it's okay to breathe with your mouth, because you've got the pressure of the water on your chest, so it's unlikely.
I mean, the thing is, I breathe out through my nose and in through my mouth, which is the opposite of running and any heavy exercise, you know, because I breathe out through my nose in the water. But then I tend to gulp, which is not helpful. So my inefficient breathing is hindering my swimming as well, because I gulp, and I notice that I gulp. And when I concentrate on forgetting about my breathing, I don't gulp.
Yeah.
It usually takes me over a mile to get to that point, though. So that's a challenge in itself. But yeah, and as I say, it's interesting, because I've also experienced that the idea of suddenly needing to yawn when I'm not tired, and that sort of trying to desperately grab air and pull it in. And I guess that's linked to that carbon dioxide again, isn't it? But yeah, so the efficient breathing you were talking about, you said earlier about it being diaphragm breathing.
Yeah.
I mean, you said about the stomach, but I notice a lot of people do that when they breathe. So what's happening then?
So if you're seeing the shoulders move when someone's breathing, you're using the accessory muscles. So I was taught as a medical student, if you're looking at someone and assessing if they're essentially working hard on their breathing, you know, is this person having an acute respiratory distress for some reason, maybe an asthma attack, look at them. Are they moving their shoulders? If you are, you're using the accessory muscles. They're not designed to be used all the time. They're for emergencies. Generally, 80% of our breathing should be with our diaphragm. Now, obviously, people talk about belly breathing, but women can move their belly without actually moving their diaphragm. They're pretty good at sort of sucking in their tummy and bringing it out. And I actually think that's another reason why women, that's the other reason why women, I think, because we've been brought up in this way that we must hold our tummies in. You hold your tummy in, you're perhaps less likely to move your diaphragm, you're more likely to move this upper chest pattern. So if people are breathing shallow or they're moving their shoulders, they're likely to be upper chest breathing. And the trouble is, efficient breathing is in and out of the nose, and then slow. At rest, it's slow, so then the air can come down, the diaphragm can come down, which actually the ribs expand outwards as you breathe in, and then the ribs come in as you exhale. So at rest, it should be silent, it should be slow, the diaphragm moving in and out by seeing the ribs going in and out, and in and out of the nose. And ideally, that's how we should breathe when we're asleep as well. Now, if we think about, you were saying about the tongue position, so breathing, there's different aspects to it, but obviously we've got a tube here, and the tube isn't massive. It's only about, we've all got slightly different anatomy, but maybe it's about the size.
As a science teacher, I've dissected many a pig or cow lungs and trachea. So it's so much fun, but
and that tube is there's parts of it that are more rigid, but there's flexible bits in it, so obviously it can collapse. And the tongue actually makes part of the back of the airway. So the back of the tongue makes part of the airway. And the trouble is, when the tongue's in the wrong position, which is in the bottom of the mouth, it's too far back. So the tongue, I think, is one of the only muscles that's connected to a bone at one end. All the other muscles are connected at two ends. So, and the bone's down here, the hyoid bone. So as soon as we open our mouth, the tongue will be either mid cavity or at the bottom. And that means it's too far back. So people can do it now upright, but it actually, this is sort of more profound if you do it laid down. So if it's safe to lie down, you can do that now. But essentially, if you open your mouth, your tongue's in the wrong position. So breathe in, listen and feel what happens at the back.
Do you know what? I ought to do what Fiona did, didn't I?
And lie down.
Shall I lie down and see
you
what
happens?
Down. You can't see me, so I'm going to lie down.
lie down and I'll talk you through it. I can't see you.
Right, lie down. Talk me through it.
So open your mouth and you'll realise that the tongue is either in the bottom of your mouth or sort of mid cavity. Breathe in and listen and feel what's happening. So that tongue's too far back and you'll probably feel a bit of obstruction at the back. Now close your mouth, but deliberately keep your tongue in the bottom of your mouth. And then breathe
Noisy.
in. Mine's a bit quieter because now I'm breathing through my nose, so I have to breathe slower, but I've still got that obstruction at the back of my throat. And then put your tongue in the correct position. So that tongue should be, the correct position is up on the roof of the mouth. So putting the tongue flat against the roof of the mouth with a light bit of suction. The tip of the tongue, you don't want the tip of the tongue right on the back of the front teeth because it's a really strong muscle and it'll make you have buck teeth. It'll move your teeth. So you want the tip of your tongue on the ridge of tissue just above your front teeth. Okay. Then you want to make sure your lips are sealed so that your nasal breathing, but you don't want to clench. So you've got an option there. For me, if I put my teeth in light contact, I clench and that stimulates that fight flight response. So that's not good.
Yeah, me too. Yeah.
So just have a tiny bit of free space between, just a tiny bit. And then, so make sure it's in the correct position and now breathe in. Good feel just that. Obviously, it depends on people's anatomy. If people have got a big airway at the back, they might not even notice the difference. If people if people have got quite a small airway at the back, it might still feel a bit obstructed. But generally, when that tongue's in the correct position, it gives a little bit more space at the back of the throat.
Yeah, I'm coming back. There was definitely a difference. And interestingly for me, with my mouth open, I didn't notice a sound. With my tongue on the bottom and my mouth closed, I could feel a resistance, and there was a bit of a vibration at the back of my mouth.
Yeah.
So yeah, that's exactly where I was. So that's why clearly why I breathe difficultly at night.
we can train, because obviously when we're asleep, that's just going to fall into the unconscious pattern.
Oh, absolutely. Yeah.
So if
I do try and help by sleeping on my front, but yeah.
Yeah, no, that's front's good, definitely. But you can, you can train yourself, can't you? So, when you're filling up your water and going to the toilet, washing your hands, just say tongue in your head and just go through the routine. Yeah. But it probably is going to take 3 months to get that muscle memory, the nerve connection, so it becomes unconscious.
And you see, one of the things for me was a while back, I was told by somebody else that if you have my tongue used to naturally be on the roof of my mouth.
Yeah.
And then I got told that means you're stressed, so relax your mouth.
Yeah.
And I think that's been part of the issue.
Yeah.
Because I think I then concentrated on catching my tongue on the roof of my mouth and dropping it. So I did the exact opposite. And so I'm now naturally trying to remember to put it on the roof of my mouth. Ever since I heard that, I've been concentrating on that. Somebody has put on the group that just by doing what you said, but sat up, they've found their breathing easier.
Yeah.
By putting the tongue on the roof of the mouth. It will open the airway up. Yeah.
Completely opens the airway up. And what I would say is, I wondered that, because I've heard that about sort of relax it, take your tongue out of the roof of the mouth to relax. Is it not more that when people, is it not more to do with the clenching of it? Because obviously that is the correct tongue for the position of the tongue. So is it not,
you see, I think it must be, but that's not what I was told.
Yeah.
Because I know I do when I clench, if I do that, then I feel stressed. But I naturally can have my mouth slightly open, but closed, my lips closed, but the jaw slightly open, and I'm fine.
Exactly. So I think it's perfectly, well, I know it's perfectly possible because this is what I do all the time. My tongue's in the roof of the mouth, my lips are sealed, but I have this tiny bit of gap in between so that I'm not clenching, and that feels, and actually I think when you have your tongue in the correct position, if you don't, you're more likely for these lips to be like that, aren't you? Whereas as soon as you put, it's more likely for these lips to become here, which from a psychological point of view, I think there's some mixed data on it. But if you, I heard a pencil study once, but I think there was another study that contradicted it. But they did a study on people who had to either hold it across the lips, so essentially the lips were like this, or they held it slightly differently so the lips were down, and the people had better happiness scores when their lips were straight. So
yes, they did. Yeah, I saw that study as well. Yes, I remember that study. But yeah, but I think also you are using, you talked about training the muscles. When the roof, you're using your muscle to lift the tongue, so you're training it and you're keeping that muscle tone there, aren't you, by doing that? And building it up if you haven't already got it. Exactly. And as you said, you have to do it when you're awake to train it. So that's why I consciously take note now of where my tongue is and go, oh, okay, that's where it is. And it does make a difference. But it was I wanted to talk to you about that thing around the mouth relax, because I think that was an issue for me. Yep. Now I know a number of other people who are listening may well be asthmatic. And when we had a brief chat before, you said that asthma can be part into this in terms of maybe there should be a conversation around efficiency of breathing before just going, here's some medication for asthma.
Well, I'm just one GP, aren't I? So I don't make.
I know, but it made so much sense what you were saying. So it's interesting to hear those sorts of views. But as an asthmatic, I do wonder if that's where, because I think my overbreathing starts with exercise.
Yeah. And if we think about it, if we breathe in and out through our mouth, we are bringing dry, cold air into the lung that's unfiltered. There's viruses, bacteria, muck, pollen, whatever, straight into the lungs. It's really harsh for the lungs. Whereas when you use your nose, it warms it, it moisturizes it, it has a go at filtering it. It can't filter out the tiny little things. and that's kind to your lungs. And I had a moment when, I mean, I've been a doctor a long time before I realized this. It was like scales fell off my eyes, and someone's, I can't remember if I read it or someone said it, and I thought, oh God, all those patients who sat in front of me, why do I keep getting chest infections? I don't know. Are you eating well? Are you stressed? And not once have I said to those patients, are you using your nose as a filter? And then the other thing I noticed was, if I listen with a stethoscope on someone's chest and their nasal breathing, I can hardly hear the breath sounds. And what do? And I've done it for years. Open your mouth, breathe. And then it makes them harsh. And then I can hear if there's a pleural effusion or some crackles or whatever. And then what happens is the patient coughs on you, and it's not their fault, because what you've just made them do is take a big breath, an open mouth, the dry cold air is coughing with. But then I didn't realize. So essentially, anybody with any sort of respiratory condition, potentially by mouth breathing, you are making that condition worse. I'm not saying that by improving your breathing efficiency, that will eradicate that condition.
No.
I'm not saying that. But surely the most basic control of a respiratory condition such as asthma is to make that breathing efficiency.
So one of the things yesterday morning when I was running, it was very cold.
Yeah.
Very cold, freezing fog. Yeah. And the other person I was running with is also as an asthma sufferer. And while I was trying to concentrate on my breathing and I could hear her breathing, and I could hear her complaining about the cold air and how it was making her breathing worse. And I just kept saying, okay, if you can't just use your nose, breathe in through your nose and out through your mouth, in through your nose, because that way it's warming it. Yeah. I was just trying to say, breathe in through your nose and out through your mouth. I was also saying, slow down, because then you'll be able to breathe better. So, and it was about, but that is so important, isn't it? That bit you said about the nose warms the air. When you're asthmatic and you're, cold air can be a trigger.
Oh, without
the other thing they've said is wear those things around your face so you're warming the air as it goes in. But I find those annoying. Yeah. So at least I don't wear glasses anymore ever since I had the cataract surgery, which was an absolute nightmare with anything like that. But breathing in through just breathing in through my nose yesterday, I didn't have anything like the reaction I would normally have for running in freezing cold air. So it's amazing, isn't it? That's my personal experience. I mean, you see, you've done a lot with your running and breathing and things, but my personal experience was, wow, this makes a difference.
Oh, completely. And there's been various days when I've run and it's been very cold, and I used to get that burning chest when I did mouth breathing and running. It's just harsh, isn't it? And I don't get that now. But obviously we're just bringing it back to the carbon dioxide. What you're talking about is obviously what happens when you're trying to exercise and maintain nasal breathing is you're generating more carbon dioxide, and then that carbon dioxide, that would go up in your blood, and then it triggers air hunger or a feeling of suffocation, and that's what feels horrible. And what people may not realize is we've got a personal tolerance to that. So mine, when I was snoring, for various reasons. One, I talk a lot for my living. One, I was going through perimenopause. One, I live in a modern day society, and I have a stressful job. So there's 4 reasons why I would potentially not have as good a carbon dioxide tolerance or breathing efficiency. And essentially my tolerance, I tried to run with nasal breathing and I couldn't do it because my carbon dioxide tolerance was poorer than it had been in the past. But you can change that. It's flexible, that, and you can train that, and then that means that you can do it, your tolerance to it goes up, so that means you can generate more carbon dioxide with your exercise before you get that feeling of suffocation. And the wonderful thing about that is carbon dioxide helps release oxygen around the body. So then you actually get improved oxygen delivery, which then helps your exercise. I would love, if there's any scientists here who actually have access to tissue oxygenation. I can put an oxygen saturation probe on someone's finger, and that tells me what's on the blood cells. And we're not interested in that. We're interested in what's in the tissues. And I would love someone, if anyone's got access to that and can stick something in my muscle and use me as a guinea pig, and let's get some taste of it. I'm there for it. But
well, there's one person watching who works in medication, but her husband works in pharmaceutical chemical. She's a chemist in the pharmaceutical industry. I'll have to ask her. Yes.
so that'll be wonderful, because I think this is so important. You know, I'm just halfway through reading A Woman's Heart, which is all about the differences between men and women with regard to cardiovascular disease and angina.
Yeah.
And I didn't realise, this is new to me, but the women are more likely to have a microvascular angina, so the angina affecting the really tiny blood vessels.
Oh, right, okay.
Rather than men would be more likely to be the bigger coronary arteries that
Yes.
get blocked, which obviously then is more amenable to having a stent and that type of thing.
Yeah.
And I'm listening to the book thinking, she's describing air hunger, she's describing suffocation, and I'm thinking, and I don't know, this is just me getting probably overexcited, but I'm thinking, if we got these women way 5-10 years before this,
Exactly, yeah.
we've improved their carbon dioxide tolerance, their oxygen delivery, would they have got microvascular angina? I don't know. It's just, I work with people who have terrible air hunger. You work on their carbon dioxide, but also diaphragmatic strength, also breathing slow, also getting the tongue in the right position, the muscle strong. And then they, like this 68-year-old lady, she can now skip continuously for 8 minutes.
Yeah.
And what's that done to her body from
exactly
a carbon, you know, and it means that the individual is not afraid of doing exercise.
Which means you do more, which means you get fitter. Absolutely. You know,
more reduced.
It's like when people say, I haven't got time to exercise, I'm too tired to exercise. It's like, no, if you exercise, you won't be as tired. So you'll have more energy to exercise. It's those strange things, isn't it, that happen. It is a really interesting topic, isn't it? This thing around breathing and how something that is automatic needs so much work to get it right if it's going wrong.
I mean, to be fair, I suspect if we all lived as we were biologically programmed to live, you know, so wake up when the sun rises, go to sleep when the sun sets, be in nature most of the time, don't be stressed, have communities and connection with others, eat a completely unprocessed diet, move all the time.
Hang on a minute. This sounds a little bit like my 6 steps to a positive menopause mindset as well. It was interesting. I was just going to go back a little bit. You said about you had sort of 4 indicators that might lead you to. So I'm just thinking, I'm a teacher, and I know there are others who are teachers in the group. I'm a teacher. Of course, I use my voice, you know, as much, if not more, than a GP. Actually, I was constantly talking. You know, that possibly, you know, I'd never even connected the fact that I spent my life talking, you know, and prior to being a teacher, I did a lot of singing. So I was still using my voice a lot and with my mouth open, you know, constant mouth opening. And so, yeah, that was, and of course it was stressful. I was a head teacher and a deputy CEO. That was very stressful. And then COVID, so that added to it. But, you know, all of those things were really interesting. Age, profession, stress levels, you know, it was just really interesting to connect, you know, that whole thing around talking a lot. And anyway, as people in the group know, I like talking a lot. But I grew accustomed to the sound of my own voice.
This accessing breathing efficiency is really difficult, because you might have said at that point, obviously you recognise now you're doing perhaps more mouth breathing than you were, but you might have a number of years ago actually, no, I nasal breathe, and you might be, but then exactly what you say, you spend 8 hours a day or whatever teaching, and you're over breathing then, so you might nasal breathe the rest of the time.
Exactly. Yeah.
You've made yourself less tolerant to carbon dioxide because of that.
Yes.
So it's not that, and I do a lot of talking, not as much as a teacher was, and teachers definitely have teachers are anyone who talks a lot, so sales, all those sort of professions, are, you know, a call center handler. So it's not that we're saying don't do those occupations, but have an awareness that my job leads to over breathing. So I need to then have a maintenance practice once a day where essentially I under breathe. So basically, well, there's different ways of doing it, but essentially a maintenance practice to make sure my carbon dioxide tolerance remains at a level that I want it to be. And that's the
because mine has definitely dropped quite considerably. You know, I was reading something about, you know, how long you can hold your breath for, and I thought, I can't. You know, I genuinely can't hold my breath without feeling incredibly uncomfortable. That has to change. I need to change that. And there must be others who are thinking, well, that's me. You know. And that's obviously going to affect the efficiency of my breathing and all of those other things, and could be part of the reason that I'm a noisy breather at night time and things like that. So just on that, I like to talk a lot. A friend of mine on the group has just put especially early in the morning. She doesn't like mornings, and I go blur in the mornings.
Well, the thing is, if you think about it, carbon dioxide is the thing that gives us that drive to take the next breath is carbon dioxide. It's not oxygen. Oxygen would have to drop quite low before that kicked in. So we breathe in and then we breathe out. And the thing that kicks us to take the next breath in is carbon dioxide tolerance. So the individuals that I know have a very high chance of carbon dioxide intolerance would be, say, somebody with long COVID. There's something about long COVID that makes people intolerant to carbon dioxide. So, and some other conditions as well, perhaps anxiety and things like that. But if someone's got very poor carbon dioxide tolerance, you can imagine they breathe in, they've not even completed the exhale before they have a drive to breathe in. Yep. And so they're breathing in, I'm only partially exhaling and breathing in again. And it actually leads to what we call medically as air trapping, because they're never doing the full exhale. So that the lungs get, I've worked with people with long COVID who their respiratory consultants say, you've got massive lungs. I've got no idea why you feel you can't breathe. Yeah. And some of the clients I've worked with, the long COVID clinics, have talked a lot about diaphragmatic breathing and breathing slow, which I completely get. But often that carbon dioxide tolerance is sometimes overlooked. And then when you work with someone in improving their carbon dioxide tolerance, and you have to do it very, very careful with someone who's very sensitive to it, but you make them then, they're able to complete the exhale before the next breath comes in. And when you get really efficient, you breathe in and you breathe out, and then I've done my exhale, but actually there's no desire to breathe now, and then it comes in. And can you imagine how calming that is to breathe like that?
I would love to be able to breathe like that, because right now I can't. And and that's one of those strange things. And is that interesting you say about that link to long COVID? Because I know a number of people who, since they had COVID, are struggling with, say, they've been diagnosed with asthma or something like that as well. And I'm wondering, there may well be not long COVID necessarily, but those other things. Because when I look up long COVID, it's not clinically a diagnosis, is it? From what I can gather.
Yeah, I mean, it's difficult, isn't it? But the definitely COVID, I think, because it's so inflammatory, it sets us in that fight flight mode. I mean, this is my simplistic thing. It's way more complicated than this, but my simplistic thing is it's really inflammatory. And how do we, if it puts us in that fight flight mode, how do we breathe in fight flight mode? Well, I'll tell you how I breathed when a dog came up to me and I thought I was going to get attacked. I was like, so it was moving my shoulders, upper chest, big breath, noisy breath, using my mouth. And that was just natural because I had a threat.
Gasping, basically. Exactly. Absolutely.
And that's how we breathe when we're more in that fight flight response, and more subtly than that. But with COVID, I think, and some people really couldn't breathe, they felt, COVID made it difficult to breathe. So, but obviously, if that individual doesn't know, it's important now to get back to breathing in and out of the nose slowly and quietly. Then they're not going to know, are they? And obviously, sometimes it's not easy just to switch like that. It's
no, but being aware of it makes you realize you need to do it, doesn't it? Try. Yeah. Because if you don't know you have to try, then you're not going to put the exercise in, are you?
Exactly.
It's one of those things, isn't it? Somebody has put down on here as well, yoga breathing really helps as well. That sort of taking that short break. And I know you talked about square breathing, didn't you, as being not necessarily that helpful sometimes.
What you've got to think about is, so this is so nuanced with breathing. So when you consciously change how you breathe, someone is literally, what you are literally taking over your autonomic nervous system. You're taking over whether your body is going to be in fight flight response or relaxation response, or moving between the two. So what I would say is it really changes you. So I'd say 3 questions. So the first question is, are you breathing efficiently? And is this practice making you breathe more efficiently? The second one, what's the aim of the practice, and does the science fit that aim? And then the third one, is that breathing practice right for me at this moment in time?
Yeah.
Because what I would say, then first question, if you're not breathing efficiently and you're going to do some sort of breathing practice or change how you breathe, well, surely to me, it would make sense to do an exercise that improves your breathing efficiency. It would not make sense to me, say, I'm not breathing efficiently, I'm now going to practice one that's going to make me more inefficient.
Say, for example, the Wim Hof breathing, which for me suggests that somebody's just going to get lightheaded and everything else, which I can't see as being a really helpful thing, particularly if they're an overbreather or they've got poor carbon dioxide tolerance and things like that.
Exactly. So that would be definitely one. So, you know, if you recognize you're not breathing efficiently, to then practice overbreathing wouldn't make sense. The next question, if we'd use Wim Hof as an example, is, does the science fit the aim? So I heard someone on a podcast describe a hyperventilation practice that said it would improve oxygen delivery. And I couldn't understand the science for that. So I thought, okay, here we go. I'll just record myself. So I put myself on Zoom and I followed the instructions that individual gave on the podcast. And I sat there with my oxygen probe. So it's on my YouTube channel. I did 3 rounds of hyperventilation and a breath hold. Now, because I have good carbon dioxide tolerance now, what that individual instructed me to do was to overbreathe. Then I do a breath hold, and I hold my breath for as long as I can. So essentially, I've blown off a load of carbon dioxide. So now my carbon dioxide level is lower than my tolerance. I do a breath hold, and I am not. So obviously, I do a breath hold. So my carbon dioxide will be coming up, but I'm not going to get the desire to breathe until I reach my carbon dioxide tolerance. And because my carbon dioxide tolerance is really quite good, I had an incredibly long breath hold, felt calm as anything because I had no desire to breathe. I felt very calm. But what happens is my lungs now run out of oxygen. And what happened was I did 3 rounds of it. The first one, my oxygens were in the 80s. The second one, I forget the exact, I was in the 70s. And the third one, I got down to 64. And I know at this point, the saturation probe is not accurate at that point anyway. And I'm at danger of a hypoxic blackout or fit. And I was
just going to say, that's not good for you at any point, is it, really?
I stopped it, and actually my oxygen went down to 62. And you can see, if you watch the video, I start looking, I've got a bit of a tan, I think, on it. And I actually look, you know, with colour in my face, and you can see the fight flight response. My body's gone into shutdown. I'm pale, I look really drawn.
So basically the oxygen's not getting to the places it needs to get to on the extremities at all, is it?
So you just because sometimes people don't always understand the carbon dioxide side of things, and there has been some deaths linked to hyperventilating, particularly around water. So by all means, look on my I think I can't remember the name of the video, but if you look on it, it's on my YouTube channel. But so I think it's knowing about breathing, and we can't then give just a breathing exercise blanket for everyone, because it depends on those questions. Do you know what I mean?
I mean, I'm all for, you know, one of the things I know about, because I'm an open water swimmer, is when I'm walking into cold water, the way I can help myself relax best is to control my breathing. Because of course there's that emergency response that goes, you know, and if I'm aware of that, I don't do it. I can actually get into the water quite well because I concentrate on relaxing, you know. But that's when I think we had a conversation, didn't we, about that Wim Hof program, because I'd had exactly the same reaction. No. But it works, you know, if it works, as you said, I think at the time, this was a way that people who lived in a stress-free life built stress to really train their breathing system. We need to do the opposite, don't we? We kind of need to get our breathing back onto where it should be, so it's automatically a nice, calm, efficient breathing. Thank you so much for the conversation tonight. I think we could probably talk for hours, because we did last time we were on talking to each other. I don't see any questions. There's been quite a lot of chatter, but no actual questions, because I think you've given everybody a lot of information. And that's really, really good. If you were to give them one piece of practical advice before we sign off, what would it be?
I would say look at how you breathe over the next week. Prospectively look at your breathing. So can you hear your breathing? Are you doing it with your mouth? Are you doing it with your upper chest? And do it when you're at rest, moving, and if you can, get some feedback of how you're sleeping, because then that will give you some idea of how efficient your breathing is. And if you recognize it's not efficient, then I'd encourage you to take action on it. You might not be ready to do that, that's fine. But you know, when you are ready, take action on it. And there's quite a bit of stuff on my website to try and help people. So, and I am trying to add more stuff onto YouTube, and obviously there's stuff on Instagram as well. So
yeah, and I will put the links to those in the group so people can do that and they can find you, which would be excellent. And I think thank you so much. The comments we've got here, an extraordinary listen, yes, and others saying yes, thank you very much. It's really useful. So I really appreciate that. But thank you so much.